Welcome to the ONC Lighting the Way for FHIR API implementation. My name is Tom Deneen with Kaufman and Associates and will be assisting with the logistical support for this Zoom session. To ask questions, please click the Q&A button at the bottom of your screen. If you have general comments, please click the chat button also at the bottom of your screen. This will pull up the chat box, which will open to the right side of your Zoom interface. Additionally, we ask that you select the speaker view option located at the top right side of your Zoom interface. This will allow you to see the speaker as they present information or share information. If you need technical assistance during the session, please type the issue into the chat box and one of our techs will respond to you. Finally, please be aware that today's session is being recorded. Closed captioning is available by clicking the CC icon at the bottom of your screen. I will now turn it over to Wes Barker.
Hey, Tom, and welcome everyone to today's Tech Forum session, lighting the way for FHIR API implementation. Next slide, please. So today we're gonna do 4 different presentations that focus on work that ONC is leading, as well as folks at the Argonaut project are leading. So provide a pretty comprehensive look at some of ONC's ongoing work in facilitating FHIR API implementation and work that the industry is leading as well in the same vein. We're going to start off today's session by providing an update on the Lantern project, which is an ONC-led project. We've had a number of Tech Forum sessions and other public webinars related to the project in the past, and look forward to providing an update on the project today, and provide those who aren't familiar with the project a little information on what it is and the resources available within the project. And then folks from ONC as well will provide an update on the Inferno project. In particular, Scott Bohan, public health analyst within our tools and testing branch, will provide that update and a demo of the Inferno application itself. And then Keith Carlson, also from ONC, will provide an overview of the ONC NPRM HTI-1 proposal on API service-based URL publication. This proposal fits in with some of the work that Lantern and Inferno have been doing over the past few years in understanding FHIR implementation and how to make information, in particular endpoint information, more accessible, more discoverable for users. And then finally, to round out the presentations, we'll have a presentation from Gino Canessa on patient access brands. Gino is a principal software engineer at Microsoft and an Argonaut member, and we look forward to that presentation on the interesting work that they've been doing on brands. And to end today's session, we will have an open Q&A discussion where we welcome participation from the audience. We'll have a few discussion questions to sort of guide discussion, but really invite just general participation questions and comments about the presentations. And in particular, we want to hear from implementers about their experiences, working with FHIR APIs, the resources, their familiarity with the resources discussed today, as well as where implementers would like to see more efforts made to sort of facilitate implementation and kind of lower the barriers that maybe people are experiencing with that. And so without further ado, I'll get things started, and I'll transition it over to my colleague Wei Chang, a public health analyst within the data analysis branch, to provide that update on the Lantern project. Good way.
Thank you, Wes. Great, so welcome everyone. I'll be first providing some updates about Lantern. Next slide, please. Great. So I think probably most of the audience is familiar with Lantern, but just to give a very brief introduction, Lantern is a tool that monitors and provides analytics about the availability and standardization of FHIR API service-based URLs or FHIR endpoints that are deployed by healthcare organizations. And Lantern queries, these FHIR endpoints are published in lists that made publicly available by certified health IT developers to establish endpoint availability and monitor changes to FHIR APIs that may signal noncompliance and accessibility issues. And to do that, Lantern really gathers data from a few different sources. So one of these sources are FHIR endpoints that are discovered in publicly available endpoint list. Lantern pulls also from ONC's Certified Health IT Product List, or CHAPL, database for product and vendor information. And Lantern also gathers data from the National Plan and Provider Enumeration System, or NPPES, for provider organization information. Next slide, please. So what does the current state of Lantern look like? As part of ONC's Health IT certification program's requirements, developers are required to certify health IT to the standardized API for patient and population services criterion in order to meet service-based URL publication requirement. And as those certificates are updated and published, Lantern has tracked and documented how developers are meeting this requirement. And on the graph to the right side of the screen, you will see at the end of 2022, we discovered through the public CHAPL list, the public Certified Health IT Product List, or CHAPL, about 200 unique endpoint lists. And out of those around 200 endpoint lists, 40% included production endpoints. And within that 40%, about 1 in 4 are published as a bundle of FHIR endpoint resources. And the remaining of the 200 endpoint list or so, 50% of which were published but included no production endpoints, and 10% of those were not in a machine readable format. And as we continue to track the progress, these results are similar to what we're seeing in the first half of 2023. And the lack of any endpoints from half of all certified API modules at the end of 2022 confirmed our early predictions that publication would not be uniform across certified API developers. And recognizing this challenge, we're striving towards the goal of making FHIR APIs usable without special effort. And one reason effort towards this goal is that we made daily downloads available on Lantern as well as ONC's GitHub page. Next slide. So some of the challenges that I've talked about in the previous slide is certainly a lack of standardization for endpoint list publications. And we found that another challenge we found is that relying only on the name of the organization is insufficient and inefficient for matching endpoints to organizations, especially when it comes to healthcare systems that service many providers. And to enable broad patient access to their health information, app developers need to really tie healthcare providers and provider organizations to their certified health IT. And what we really need is a more predictable, standardized way for app developers, patients, as well as other to consume these endpoint lists. Next slide. So what are some of the solutions available? We really want to encourage you to check out the Lantern report that was recently released if you haven't already. In the report, there are proposed solutions to the challenges that I mentioned. And really, the report summarizes our consensus-driven work and previous discussions at public workshops, meetings, as well as HL7 committees. And these efforts evolved into ONC recommendations and the notice of proposed rulemaking that was released in April. So that notice of proposed rulemaking proposed updates to the ONC certification program with requirements applicable for developers certifying to the standardized API for patient and population services. And one of those proposed updates is to revise and standardize the service-based URL publication requirement, which Keith will discuss later in this presentation. And we're also excited to see industry-led activities, such as the patient access brands and endpoints, which you will also get a chance to hear more about in Gino's presentation about the Argonaut project. So before we dive into rest of the presentations, I'll turn it over to Wes for a brief demo on Lantern. Wes?
Thank you, Wei. Yeah, and Tom, I will go ahead and share my screen. Great. All right. I'll just do a brief, walkthrough of the Lantern dashboard itself. Especially for those who aren't familiar with it, but just kind of give a good update of, what the current data shows and tying into the presentation that Wei had just given. So lantern.healthit.gov is the official location for the Lantern dashboard. This is where we, sort of display kind of current daily metrics on the endpoints that are currently ingested into Lantern. And, to give a little bit of sort of scope on that, and to tie into some of the points that Wei had just made in her presentation, we have to ingest these endpoints, from each of those lists that are discovered. And so there's 200 endpoint lists as of the end of 2022 that are discoverable through the chapel. Each of those endpoint lists has to basically be indexed into Lantern, mostly because as it currently stands, there aren't, a defined set of publication requirements for those URLs. Or for those endpoint lists. And so for each list, some ways you have to develop unique parsers to be able to, navigate to the, the right URL location and then parse the specific list, in whatever format it is, HTML, JSON, FHIR bundle, etc. So, a lot of hard work has gone into sort of incorporating all of those lists, particularly from the chapel, into Lantern. And so, current state, that's what what Lantern mostly represents. And it's over 20,000 total endpoints that we've indexed in Lantern itself. And like I said, Lantern's designed to query those endpoints on a daily basis to provide, updated metrics for each of those endpoints. And one thing that Wei had also referred to was, we provide daily downloads of the data. There's a tab within the dashboard called Downloads. You can also get the daily download data in the Endpoints tab as well. Just this month, we actually started exporting each of those daily downloads to a repo on the ONC GitHub. And that's also included, a link included in the presentation as well to that. And basically provides each of those daily downloads in a CSV machine readable format. So we obviously just started doing that download or that upload into the GitHub repo this month, but we look forward to maintaining that that daily update or daily upload onto GitHub. So folks who are interested in looking backward and tracking those endpoints over time don't have to rely specifically on just the daily download, but actually can have access to that historical data, as we continue to upload it into that repo. And to that point, we're also looking forward to updating other data features and access within Lantern. And so look forward to that, and we we'll certainly update folks as those updates are made through ONC's communication channels. So I'll just do quick look at some aspects of the dashboard to give people a nice little understanding of the data in here. So this initial just sort of dashboard provides just sort of the basic understanding of the comprehensiveness of the endpoints that are indexed in Lantern. You get some like basic sort of metrics on those totals, and some charts to kind of give you an understanding of the sources for those endpoints. As we said, many of these endpoints are indexed from the chapel, and so the health IT vendor name is used within the Lantern dashboard, and that's the exact name that's used as part of those certificates that are discoverable through the chapel. And so this should resonate with folks who are used to working with those developers. And so this chart simply just provides like a easy look at the scope of the developers who have endpoints that are indexed in Lantern, and then big long chart, and a nice understanding of like the certain current state. And so we do track the sort of accessibility uptime of these endpoints. So it's a guide to us too, because sometimes, like I had said at the start of the demo, we might index endpoints from the original source. But what we found is that sometimes, those original endpoint sources can change. And, without sort of a defined publication format or, standardized process, those URLs could change, the, way that the information or the way the endpoints are, made accessible, like the data format, the data structure can change, because we, currently have no requirements about, those certain aspects of publication. And so what we have found is that, sometimes, we've indexed endpoints from a particular list. That original list may change format, data variables, et cetera. In a good way, they may be expanding the, sort of total data set and information that they provide in it. But if it's not, if it doesn't like sort of fit in with the original parser that we created, you're going to have some breaking changes. So, the parser won't work if you change the original, data source in any way, be it the data format or, data structure, et cetera. And obviously, as Wei alluded to, and Keith will talk a little bit more about, is that some proposed methods of facilitating a little bit more standardized publication, so that you may have a situation where everyone is publishing in the same way, same manner, and that just makes it a lot more predictable to sort of pull those endpoints a lot more consistently. And any breaking changes would be a little bit more easily solved, because it wouldn't necessarily be a formatting issue, but rather maybe something else. And so so these are things that we track regularly on Lantern to give us perspective, as well as the public full perspective on what we're tracking. And I think some key things to look at that I would recommend. I mean, we have a lot of different little tabs within the Lantern site itself to provide a little bit of insight on particular aspects of the endpoints. One of the key things we do that Lantern is designed to do is not only pull some specific information about the endpoint itself, but also, each day the machine does a query of the metadata API for each of those endpoints, and to test that that endpoint can serve a compliant capability statement. And when if the endpoint does serve that compliant capability statement, Lantern is designed to pull information from that capability statement to inform some of these other sort of dashboard tabs within Lantern itself, to understand type of smart response, security applications, things like that are used for each of those endpoints. And so right here you get sort of the full list of endpoints that we have indexed in Lantern right now. And like I said, you can download that data here directly. There's also a separate downloads tab where you can get it. And as I said, in the Lantern repo on the ONC GitHub, you can also get today's data as well as the past weeks as well. But basically this page is just providing a good understanding of sort of here's the information that we're collecting at a very high level, the same information that you can find in the downloadable file as well. And yeah, I think, that provides like a pretty good understanding of what's available right now, how to navigate the Lantern dashboard itself. So yeah, obviously, like I said at the start of the presentation, we'll have full Q&A discussion at the end after Gino's presentation. So look forward to questions and feedback from the group then. We'll stop sharing. And I will pass it on to Scott Bohan, who, oh, actually, one quick thing I forgot before I turn it over to Scott. Here's a list of Lantern resources. Again, this slide deck will be made available on the TechMore website, after this session at some point, hopefully soon. And so you can grab these links then when the slide deck is available. But did want to, showcase, we have some historical information, resources, webinars that we've had in the past, but we also have just in the past week some new things that folks would be interested in reading. A new Buzz blog. You can go to the ONC Buzz blog today. Check out that new blog. All of this information is referenced in that blog as well. But we have a new report that provides a summative sort of report on the work that Lantern has done over the past few years. So for those unfamiliar with Lantern or want to know more, that is a great report that provides a lot of that information. And then, yes, now I conclude. So now I can pass it over to Scott to provide an Inferno update. Thank you, Scott.
All right, thanks, Wes. Hello, I am Scott Bohan. I work at ONC in the Tools and Testing branch, and I'm here to talk about FHIR testing and the Inferno testing tool. Next slide, please. All right, to get started, let's first discuss some important components for FHIR testing. On the left-hand side of the diagram here is where we start with the requirements. And so the requirements overall come from the intended use case, and in a technical sense come from the FHIR implementation guides. And so these implementation guides contain the technical specifications that the system needs to conform to. An example of an implementation guide is US Core, which defines requirements for accessing patient data via a FHIR API. Next are the conformance artifacts that serve as a benchmark or a reference point. These artifacts include things like a reference server, which is an implementation of the set requirements that serves as a reference for other systems trying to meet conformance. Second is a reference server, which is often populated with reference data, which is data conformant to the set requirement. And third is the conformance tests, which are used by a testing tool to show a system is conformant to the requirements. And so a testing tool such as Inferno may contain all of these testing artifacts to support testing system conformance. And while a testing tool can rarely cover every possible test case, they may test common pathways and scenarios to provide a general idea of a system's conformance to the set requirements. And the results of a test tool can be used for official reasons, such as for certification programs or as part of a system's development cycle to uncover software bugs and unexpected behaviors. Next slide, please. And to provide some additional context, here are some FHIR testing tools that are used by the FHIR community. First is Inferno, which was created for the ONC certification program to test FHIR capabilities. Inferno is an official testing tool for testing the requirements of the ONC G10 standardized API for patient and population services certification criterion. Inferno also supports testing other implementation guides and standards of interest to the community. These include security standards and Smart on FHIR standards. Inferno is also based on the Ruby programming language to provide some test writing flexibility, and as a platform can support the development of tests for new FHIR implementation guides and related standards. Second on this list is the Aegis Touchstone tool. Touchstone provides testing for many FHIR implementation guides and also supports testing for the ONC G10 standardized API for patient and population services criterion and is designated as an ONC alternative test method. Touchstone uses and extends the FHIR test script resource as a means to write FHIR tests. And third is the NIST FHIR toolkit. This testing toolkit supports testing of interest to the IHE and FHIR standards communities. And similar to Touchstone, NIST FHIR toolkit also uses and extends the FHIR test script resource for writing its FHIR tests. Next slide, please. All right, this slide provides some more details about what defines Inferno as a testing tool. One of the primary functions of Inferno is to provide testing for the ONC certification program. Inferno is an official ONC testing tool and supports certification of health IT. In addition to supporting the program in an official capacity, it is also a platform for general FHIR testing. Inferno can be used by health IT developers in their software development cycles to help verify their implementation's conformance to FHIR. Inferno supports many FHIR implementation guides such as US Core, Bulk Data Access, and Smart App Launch. Inferno is also designed to be flexible in how users interact with it. It supports a graphical user interface for manual testing, as well as an API for programmatic automated machine testing. And finally, Inferno is transparent and open source. And this means that Inferno code is free to use and benefits from community review and feedback, and provides the documentation necessary to be adapted for other use cases by the community. Next slide, please. And so just here are some additional details about FHIR testing in the ONC certification program. So Inferno testing for the G10 criterion covers many aspects of FHIR testing, including endpoint capability discovery, authorization and authentication, security tests, single patient and bulk data access testing, and validation of FHIR resources, amongst other tests. So Inferno is designed to support testing general FHIR capabilities, so new tests for other use cases can be made. This includes things like new ONC certification program features, like, for example, the newly approved standards, such as in the standards version advancement process, as well as testing for the FHIR community in general, such as testing new implementation guides at HL7 FHIR Connectathons. Another example is the ongoing Karen IG for Blue Button testing pilot for Inferno, which can serve to inform future Inferno testing for the community. Next slide, please. And so this diagram here just illustrates how the G10 criterion that was mentioned earlier is structured. So provider systems containing clinical data are made accessible via FHIR APIs, one for individual patient data and another for bulk data access. Specific FHIR implementation guides define the requirements for those APIs. And additionally, those APIs also have a security layer for app authorization. This security layer is designed around the OAuth 2.0 standard, so app authorization to access data is done in a secure manner. Consumer and system apps can then use these secure FHIR APIs to access clinical data from providers. All right, we can go to the next slide, which is our Inferno demo. So I will share my screen and just show a little bit about Inferno. All right. So what you're seeing now is inferno.healthit.gov, the homepage for ONC's hosted instance of the Inferno testing tool. So on the left of the page here, we can access the certification program test kits, as well as tests and utilities provided for general community use. And then on the right side of the page, we can find the Inferno framework documentation for those that are interested in learning more about the internal workings of Inferno and how to write your own tests using the Inferno framework. To show an example of an Inferno test kit, we will go through the G10 test kit, which is used as part of certification for the G10 standardized API for patient and population services certification criterion. So we'll go into that test kit. And so then we see this standard selection page. As some background, using the standard version advancement process, also known as SVAP, developers can certify to different combinations of standards. And the G10 test kit enables this by allowing developers to select which standards to test during certification testing. And for the purposes of this demo, I'll just keep the default selection of standards. All right, so this is the main user interface for the G10 test kit. At the top of the screen, we see the test kit version number, as well as the standards selected for reference. And then below that is the option to select a preset configuration for testing. And so this preset populates the test parameters with information to save time. We'll select the Inferno reference server preset to populate the test parameters with information about the Inferno reference server, which is a server compliant to G10 requirements for demonstration purposes. So we'll select Inferno reference server preset. And with that preset selected, we will see certain information included in the test parameters. And so to show that, we'll first go to the first set of tests here, the standalone patient app tests. So in this test scenario, Inferno checks that the server supports one of the required authorization flows, the standalone launch Smart on FHIR capability. Essentially here, Inferno checks that the server supports an app launch from outside the EHR and that the application can access information via the server's FHIR API using this launch flow. So when we click to run the tests, this displays the testing parameters needed to run the tests. And since we're using the Inferno reference server preset, this information is already populated for us. The parameters needed for this test include information such as the client ID of the app, which would be provided during registration, and as well as the access permissions being requested by the application, which are referred to as scopes. And I'll also note that Inferno test parameters can be entered either individually, as you can see through these forms, or through data structures such as JSON or YAML. And this is useful if the tester has prepared those test parameters ahead of time and can paste them directly into the Inferno form here. So now that we've verified the test parameters, we hit submit. And then now we're going to proceed through the Smart App Launch flow. So these next few screens will provide an example of a user providing authorization for an app to access information via the FHIR or via the server's FHIR API. All right, so for example, we'll select the relevant patient and confirm the permissions that are being requested. So after providing authorization, we return to the Inferno page and see the results of the test. Since Inferno was able to complete the app launch successfully, the tests are marked as successful. And then more details of each test result can be found by clicking on the individual tests. And we can see that here. And so the remaining tests listed here cover other aspects of the G10 criterion testing, which is testing other requirements of the single patient API, as well as the bulk data API and other tests related to the G10 criterion. And so after running the Inferno tests, a report is generated with the test results, and we can see the test report here. And so if the tester encounters a software bug during testing, that can be reported using the report issue button at the bottom of the screen. And if a tester is interested in running Inferno tests locally on their own machines, they can click the download button for more information about that. And so that concludes our overview of the Inferno testing tool. And if you are interested in learning more about Inferno, please visit inferno.healthit.gov. And I'll stop sharing my screen and pass it over to Keith.
Thank you, Scott. Yeah, hello, everyone. This is Keith Carlson. I work alongside Scott in the Tools and Testing branch at ONC. And I have a couple slides here. I'm going to just talk about ONC's most recent rulemaking activities around the publication of service-based URLs. That's the technical term we use for, FHIR endpoints. All the requirements that Scott just went over, those are the technical requirements that we finalized for our G10 standardized FHIR API for patient and population services. But we have kind of another set of what we call conditions and maintenance of certification requirements that are kind of like business and behavioral rules for API developers that certify to those technical requirements. And one of the ongoing requirements that they have is that they need to make available and publish and keep updated the service-based URLs for their customers that deploy technology certified to our FHIR API requirements. And we've kind of recently put out a proposal to update these requirements. And so we can go the next slide here. And I'll start to talk about what this proposal is. This is in ONC's HTI1 NPRM. If you Google ONC HTI1, you'll see a lot of information about that. Because what we require today, so what was finalized back in 2020 in the ONC Cures Act final rule, was that service-based URLs must be published, we just say in our regulations, in a machine-readable format at no charge. We don't specify a specific machine-readable format. And so, as we've already heard, and is kind of a big reason for us gathering here, is that there are, these endpoint lists are published in many different formats, and it makes it hard to consolidate endpoints from across vendors because vendors can kind of choose their own formats. So to kind of start to address this, we've proposed in HTI1 to update our certification program to require that these endpoints be published in a standardized format based on FHIR and US Core. And then we've also put in a specific requirement too, saying that we would expect, we're proposing to require that these endpoint lists, these standardized endpoint lists, be updated by vendors quarterly, or that they review them quarterly and update as necessary. And we believe, this has many benefits for many reasons we've heard folks talk about in this talk already. But we believe that, these standardized publication of FHIR endpoints and our proposal specifically, aligns with industry approaches to publishing service-based URLs. We believe that this will have the benefit of improving the availability of service-based URLs that can be used by patients to access their data without special effort. And then, this standardized endpoint lists will also enable tools like Lantern or any other sorts of tools, to be able to actively monitor endpoints and, just for the public, for people who want to actively monitor endpoints, having standardized lists across vendors will make that easier. So with that, we can go to the next slide. And so in addition to requiring that, the URL be published in FHIR endpoint resource format, we are also proposing to require, as part of this proposal, proposing to require that related organization details for organizations that manage that endpoint, or the one organization that manages, each endpoint must also be published. Again, this is not something we currently require. We just require that the URL be published. But, I have an example here, and this is an example we included in our HTI1 proposal of, you can take an example of let's say an organization, Acme Children's Hospital, that could have, many different sub-organizations, maybe that, they have a children's hospital for anesthesiology, and then a children's hospital urgent care, and then a, ambulatory care part of their children's hospital. This is just an example showing how, depending on how Acme deploys their, if they, want to deploy certified technology, depending on how they deploy their EHR, there might be one EHR for each of those kind of subcomponents. And you know, a service-based URL that just kind of has maybe it says like acme.com/ or acme.org/FHIR/R4, you know, it's not going to be clear which, if that one URL references all the sub-organizations, maybe they just kind of publish a bunch of URLs with different IDs for these sub-organizations, but, you know, it certainly won't be clear to a developer trying to, you know, map that organization or map that, you know, to just take that endpoint and be able to map it to a real world organization. You know, a developer creating a patient-facing app will want to presumably enable an experience for a patient to type in identifiers like a name that a patient knows or some kind of location, because, you know, a patient coming to an app is going to know, I visited this, you know, physical organization at this location in the United States. And you obviously just can't you can't infer all that information from just a service-based URL. So we're proposing to require that organization details be published also in a standardized format, which would be the FHIR or the US core organization resource. And we're proposing to require that, like, within that organization resource, there should be an organization name, location, some kind of like identifier for that organization, whether it be like a facility identifier or if it's just one provider deploying a certified technology, you know, provider identifier. And that those, you know, organization and endpoint resources reference each other in a way so that, you know, someone can take an endpoint, find the referencing organization resource and kind of have more context for the organization around that specific endpoint. And so, and, you know, is an important part of our proposal too, is that we're just proposing to require that these endpoint and organization resources be collected in a bundle format. That will be what is published on the chapel for the public to have access to if our proposal is finalized. So I think those are kind of the main points from this talk. And, you know, this is a good segue into kind of some more specific industry work around this, because we've really tried to kind of keep an eye on where industry is going, and you know, some of the Argonaut work has been really exciting. So I'll go ahead and pass it over to Gino to start to go into more specifics of some other work related to this.
Sounds great. Thank you, Keith. And I think Wes, if I could grab this, or Tom, if I could grab screen share. Thank you. And there we go. All right. Well, hello, I'm Gino Canessa with Microsoft, and talk about the segment here of patient access brands from Argonaut, connecting with your FHIR. Just quickly, what we'll go through here is some problem framing and scoping, although all of the previous segments have covered a lot of that, so we'll be able to get through it quickly. Some of the solution stuff from the work we've done, and then at the end is QA discussion, which is actually part of the all speakers panel, so that is coming up soon. As I said, the obligatory about me, I'm a principal software engineer at Microsoft, work in research on the health futures team. Specifically, our team does healthcare standards and interoperability. I've been doing FHIR since 2019, really focused on infrastructure, kind of these core building blocks, things like that. Before that, I spent a couple of decades in DICOM, and yes, apologies for the CDs. We always thought they had about 5 years before they were phased out, and they're still here. And then contact information there at the bottom. So why are we talking about brands? And really a lot of it comes back to the patient question of how do I connect to my provider, right? And a lot of the earlier segments talked about that we're publishing FHIR server URLs, right? That these things should all be published, still work in progress. But unfortunately, patients don't really know facilities by their URLs. In fact, they may not know the correct name of their facility at all. When you've been going to Dr. Jones's office for 30 years already, you're going to call it Dr. Jones's office, regardless of how many tiers have purchased that facility by now. And then, as Keith was just showing, even if you do know all of that, navigating the divisions and orgs within one of these systems can be very challenging. When you're talking about things that can be geographically divided or demographically divided, you know, separate FHIR endpoints for pediatrics versus adults versus cancer patients, et cetera. And no two facilities are going to be the same. To be clear, providers don't have it much better. So far, there had not been a recommended format or location to publish. And again, this was discussed earlier. But because of this, when they're publishing, they have to build this brand each time, right? Different vendors are building different solutions, and whenever a provider wants to interact with them, they have to figure out what their requirements are, get new logos, new banners, update the names, update the structure, and it's a lot of repeated work that, quite frankly, providers have better things to be doing with their time. Vendors, again, not too much of a better situation there. Since they're required to publish something, but there's no recommended format, we see FHIR, we see HTML, we see Excel spreadsheets, we see whatever they need to do in order to move their business forward and meet regulations. And again, hopefully regulations always mirror what we're doing in the real world and vice versa. And so this is stepping towards that. And really, it's addressing the problem of everyone building their own custom solutions and the extra overhead that the vendors have to put in. A lot of vendors have these provider portals where they manage their brand information, or you have to call up and file a support ticket to get something updated. And none of that is really what people want to be doing. The next group here, not too often talked about, but are the client developers. And these are the ones that are putting the apps right in front of the patients. And they only have access to very minimal information right now. And then as people are producing that information, they kind of hack in to get the desired display. No judgment, we've all been there. If there's no place for you to put your facility name and you have an address field, you prepend it to the address. We've all been there, we've all done it. But at the end of the day, it ends up with a lot of confused and lost users. So not great. And in practice, and these screenshots are a little bit old on purpose to show this. So these are back from 2021, 2022 timeframe. But you can see vendors were just starting to try and figure out how to provide this information to people. So there's a lot of different formats. Some of them have more technical names, some of them have more friendly names, some have logos, some have banners, some have neither. It's confusing, and especially when patients are coordinating between different facilities using different apps, it can be very difficult to actually match up where these things are coming from. It's not all bad. Again, I was spoiled for choice here, and I picked to record this on my phone because I had my phone in my pocket and could record it. But vendors were building out these solutions. And so you can see here, oops, this is grab here, it's location aware. This is using Apple Health Kit just from my phone. And you can see it knows all the providers in my area. It has different types of branding. So in my case, I'm in Madison, Wisconsin, but UnityPoint prefers to have one endpoint and all their locations are kind of hidden. Whereas UW prefers to list every location as an individual, but then, and I happen to use that clinic, they list one FHIR endpoint for all of them. So you can see, again, these are some of the things I think Keith was alluding to, that there are a lot of different potential structures here. And vendors are incentivized to get this right. They want to build things that meet their customer needs. And unfortunately, it's very complicated. And a lot of these solutions are going to depend on what market segment that vendor is trying to address. So then enter Argonaut. For context, if people aren't aware, Argonaut is a FHIR accelerator. These are programs within HL7 to kind of gather focused consensus groups to get some work done and then bring it back to the larger audience, really to avoid the design by committee pitfalls that can happen when you're trying to build things in a large international organization. So in this case, there were a bunch of vendors who wanted quick alignment for things that they had in production, right? Going back to those earlier screenshots, these were things that are already in their production services, and they just wanted to make sure they stopped diverging and started converging. So everyone wanted to develop a universal solution and make sure that it had a path forward through HL7. And so that's our breadbasket. In this case, the project was started as FHIR Endpoint and Structure. We're a bunch of technical people mostly. Thankfully, it was renamed to Patient Access Brands, but in case you come across the earlier name, I don't want any confusion. The project was back in 2022. It was a mini project, so only a few months. Again, since many vendors had this in production already, a lot of the work could be fast-tracked in all of their learnings. This link here is to the Confluence page because this is all done openly. So the meeting minutes and everything else are all linked there, and this deck will be available. Important to note about the project was it was a very limited scope. We wanted to focus on the building blocks of this information, and we were very sure we did not want to be a directory. There's a lot of other places for directories, and that's a much different type of project. And so we wanted to make the pieces that directories can use not be a directory. The project had regular attendance of more than 20 organizations, and we've already had 2 connectathons testing this with snippets from real world data to make sure we get all these edge cases covered. And as I said, very focused. So the solution is actually just a couple of profiles on organization and endpoint. There's a handful of extensions, and then the discovery was added to the Smart Well-Known to make it very easy for everyone to tie into existing processes. And then obviously clarifying the core concepts with some guidance. I won't go into too much detail. We'll have links to the spec and things like that. But just to highlight a few things, for instance, in endpoints, one of the extensions we added was the FHIR version. There are a lot of contexts where you already know the version implicitly when you're looking at an endpoint resource. But in these cases, a lot of times you don't. You might want to know that we're listing an R4 endpoint and an R5 endpoint or the STU2 endpoint, and we want to put them all together. And there's no good way in FHIR to represent that information yet. So these are the types of things that we were adding. Same thing on organizations, agreeing on a nomenclature for the types of organizations, data aggregators versus outpatient versus hospital and all those things. And then really setting up these brand logos, logo usage agreements. Again, hospitals need to, or providers need to protect their brand information, and people who want to use it need to know how they're authorized to use it and when. And separating that out from portals, their names, URLs, descriptions, logos, all that kind of stuff. And then all this nesting so that we can build these complicated structures of organizations. As promised, there are links to the specification. It's a draft right now because the work is very solidified, but it's being split up into different homes and where it's best applicable as we go through the HL7 processes. So right now the link is in the spec is in the Smart App Launch. And so are all the profiles, extensions, and examples. The extensions, many of the extensions are likely going to be over and moved into the FHIR core extensions, again, so that these things are more universal and more easily accessible to everyone to drive convergence. And then same thing, there's discussion that the profiles might be added to things in US core, or things like that. These are ongoing discussions. So what does it actually look like? And in this case, I will jump around here a little bit, but there's a link on the Confluence page, and I believe in the spec. This is the reference implementation of a brand editor. And so you can see here, we're just going through and filling out, I'm using the same example I used earlier of UW Health. And we have slots for all these different pieces of information: branding, websites, aliases, logos, what categories your facility is in, the portal details, and everything else. And then you can see kind of these user cards there on the left that are being built as we fill in this information. In this case, we're going to add an affiliated brand and go through the same process. And we can see that in this case, I'm adding that same Verona clinic that I was looking at earlier, and setting up the logos, the categories. But down here, I'm telling it to keep using the same portal. Oops, there we go. So in this case, it's saying, yes, I have a bunch of nested organizations, but I want to keep using the same portal for all of them. Conversely, you can say, no, I want to use different portals and keep the same organization. And then on the right side here, it's building, as we fill all this out, a FHIR bundle that you can actually copy and go play with in other places. So what do we get? We end up with simplified management for providers and vendors. We stop replicating all this work over and over again in different places. Patients get better consistency when they look up their providers in different apps on different platforms. they'll see the same logos, they'll see the same names, they'll see the same structure in all these things. And at the end of the day, it's just improving access to records, which I think we all know the benefits of in the context of healthcare. So with that, I will say thank you for attention and pass it back over to Wes to get to the panel discussion.
All right. Thank you so much, Gino. Tom, will share the discussion slide real quick. All right, excellent. So yeah, so we're gonna turn it over to, Q&A discussion section. I mean, we've covered a lot of ground. Got great presentations on Lantern, Inferno, and then on brands. Brought up a lot of good points. There's already been some some busy Q&A in the Q&A feature, and speakers are answering some of those questions live in the Q&A. But we also welcome if anyone has specific thoughts or they want to share their own experiences implementing FHIR-based APIs. And even their experience using any of these resources that we discussed today. We also invite folks, if you want to raise your hand, come off mute, speak out loud. I know it's strange and weird, but if you want to do it, you certainly can. Obviously I will facilitate folks to express their thoughts, share their experiences. I think I speak in particularly on behalf of ONC. I mean, we always look forward to hearing, from the public about the work that we're doing, and we're always looking to find new ways to help, support, public efforts, to connect to APIs without special effort. So, the more information that's shared from you, the better our tools and resources can be that meet your needs. And so, if certainly welcome anyone to come off mute and share their thoughts and experiences. Otherwise, feel welcome to ask any questions directly in the Q&A feature. I think Wei and I will be taking a look at that and seeing where we can answer any questions directly from there. So Wei, do you see any questions in the Q&A that we can sort of like anyone from the group can answer?
Yes. So we have a question from Daniel about if FHIR endpoint specifications were required to be part of the MPPES data, would that address the problem of reliably identifying organizations?
Yeah, I'll take certainly a first stab at this, but obviously welcome other folks' perspectives on it too. So I will share that CMS does have requirements for healthcare providers to provide sort of electronic addresses within MPES. So there's, I think 3 years ago, I think it was part of the patient access rule that they finalized in 2020, updated sort of requirements within MPES for providers, documenting information within that to include electronic endpoints. And so, that could include FHIR endpoints associated with that specific, provider or their organization. That includes direct addresses, other, valid endpoints that people would want to share. I will say that from our experience, the data there is very limited. CMS does put out that data publicly. You can actually download the entire MPES database every day. I mean, if it updates, they create a new export file for it. And a part of that is included sort of an electronic endpoint data list. And so that includes all the providers that list electronic endpoint data. I think it was originally intended as a way to kind of showcase, like, here's everyone who's compliant, non-compliant with our requirements. It turns out almost everybody's not compliant with the original requirement. So from our own analysis at MPES, there's very few valid FHIR endpoints that are included in any one sort of MPES profile. We've actually bumped Lantern up against MPES to kind of test that over time, and it really hasn't changed all that much. You know, I think there's reasons for it. You know, MPES is typically updated and kept in, you know, kept up by individual providers. So it could be a provider organization. So you're like practice, you may have like, you know, staff of the practice who, you know, keep that information updated for the individual providers, clinicians that are at that practice. But largely it's like individual MPI level providers. So, you know, you're a doctor, a nurse practitioner, et cetera, you maintain the information within that MPI profile. And, you know, in a lot of cases, those individuals don't know what an endpoint is, much less what a FHIR endpoint is. And so it's, you know, kind of tough for them to be able to kind of share that information when that's not something that's, you know, they can really surface easily. Because, you know, I'm not 100% familiar with how, you know, an individual doctor would be able to find out what his FHIR endpoint is for his practice, but, you know, just from his like desktop or DHR, but, you know, find that information and putting into MPES for an individual clinician, by an individual clinician, I think is pretty tough from experience. And so, you know, if that were the case, I mean, if, you know, there were other requirements or, you know, CMS or others were able to facilitate, you know, directory work that, you know, kept, you know, a, you know, data system like MPES up to date with records of endpoints associated with unique MPIs, you know, obviously I think that would be like, you know, a great resource and a great robust directory where people could, you know, find that information. But as it stands, you know, it's currently not the reality. But, you know, I'm, you know, sure that, you know, there is work ongoing to kind of address that and, you know, make sure that, you know, a lot of the systems like MPES and, you know, any other directories can help, you know, facilitate that sort of identification between provider and endpoint. A great question.
Wes, we have two questions that are related to IG, both from an anonymous attendee, so I'm not quite sure if they're from the same person, but one is earlier in the presentation about any update on when IG support will actually be implemented. And then another one that was later on, I think during Gino's presentation, that asked about what about which IGs are supported.
So, Gino, I don't know if you can answer that question related to brands first.
Right now, the brands work is living in the Smart App Launch IG as a draft. And that's what we're talking about, that as we finished the project in Argonaut, and then we're going through the HL7 processes, some things are moving around. So a lot of the extensions, people have been asking if we can move them into core so that they're more available to things like when you're doing backend services or even non-RESTful FHIR and things like that. So that's why there's a few things moving there. And then same thing in jurisdictional contexts, people are saying this guidance might be adopted into, for example, US core. People have asked about it. I can't speak to what's happening or not on that front, but a lot of that guidance will still get split up. So all the processes and blocks are in place, and it's just shuffling them around and getting all that feedback.
Great. And then, yeah, the other question I think we had referenced, is there any update on when IG support will actually be implemented? It may have been asked, I think maybe Scott, when you were discussing the Inferno work. I don't know if that question resonates, whether or not there's specific IG support within the Inferno tool.
Yeah, I'm not sure, because Inferno does support many different implementation guides. So it would be good to get some more specific clarification around which implementation guide they're referring to, since, you know, US Core is supported, Smart App Launch is supported. So yeah, we would need some clarification as to which IG is being referenced.
So I
Okay.
see
Yeah, and I
two
see,
more.
oh,
Yeah.
sorry, wait, go ahead.
Right. Oh no, I see two more follow-up, I think, to that question. And it says the question was directed for Lantern, asking which IGs the endpoint support. And
See
I
that,
was,
yeah. Yeah, I think after Inferno was like, well, you know, the only one left is Lantern. Yeah, I mean, I would say that within the capability statement, you know, there's the ability to reference the particular implementation guide that's used, you know, for that particular endpoint. And so, you know, if that information is contained within the capability statement itself, you know, that's data that Lantern is programmed to pull. But I'm unsure, maybe it's a question for Scott or Keith of whether or not, you know, we're requiring as part of, I guess, our FHIR implementation for G10, like if developers would be expected to include the specific IG for those, you know, our FHIR implementations within their capability statement.
Yeah, I'm trying to recall, I don't recall specifically at the moment the exact requirements for what needs to be included in the capability statement regarding IGs, but yeah, I would just need to go back and check you know, what exactly is required for that. But yeah,
no, absolutely. And that's a great question. And, you know, I think just speaking for Lantern, how it's been developed, I mean, it is, you know, the scope, it is within scope to pull that IG information from the capability statement. So, you know, if it's not provided, it wouldn't be included. But in terms of how Lantern is designed to pull it, yeah, it does support, you know, pulling that information available from the capability statement. So.
I do see a follow-up, and so asking which IGs the endpoint support for brands, and Avinash had chime into that and ask if Gino could talk about the general implementation testing of the patient access brands IG and his view on readiness for widespread implementation by industry.
Sure. The IG implementation is obviously going to be held up by publication, and those are the steps we're working through right now. So as the links on Confluence show, there's been a couple of connectathons already, and the vendors that attend and what they've done are all listed in these report outs so that everyone can go and browse that information and see who's been engaging and to what extent. So there's been a lot of great support from a lot of the Argonaut members. So a lot of these pieces are getting implemented already, even though they're not the final pieces yet. As we get them published, I expect it to be relatively quick. Again, quick in the context of healthcare implementations, which I think we can all speak to, because these are things that are in production, and this is what the vendors are asking for. That's why this work was undertaken when it was. So I can't imagine it's going to be, you know, a super long, but I also can't, we have to get through publication before I can give any answer clearer than that, unfortunately. Was there a second part? General implementation, yes, and testing, yes, and then yeah, testing. Like I said, we've already had 2 connectathons, and I think the sample data is still in the GitHub repo that's linked there with the connectathon information on the Confluence page. So you can see some actual examples from vendors saying, "Oh, this is how we can structure and show what parts we have and what parts we don't, and all these different things." So as we said, the feedback's been great, and it seems to be addressing all the needs. And then we'll get additional feedback as we finish going through publication and everything else. And then just as a quick aside, because it's come up, I think once or twice in the questions as well, I did type answers, but to clarify the distinction between Microsoft and Argonaut and everything else, I just happen to work for Microsoft. They sponsor our team. There's Josh Mandel, myself, and Brian Postlethwaite, and we get to work on standards and interoperability entirely out in the open. We aren't connected with any of the product teams. We don't know their roadmaps. I can't answer your Azure questions, but it lets us speak at these types of things and do this kind of work just in general. So just to clarify, we put their name on slides and things like that because they do give me my paycheck and let us do this work. But this work is under the umbrella of Argonaut and everything else.
Great. Thanks, Gino. So we have another question in the chat. So for developers that already have established proprietary API integrations, what would be a best practice cutover for FHIR recommendations to integrations? It remains easier to manage integrations on established APIs versus FHIR API endpoints for partner integrations.
I'm going to assume that that's in the context of the brands for questions. Unless someone else wants to take it. I don't know that I can give a best practice yet until we're actually at the finished publication and rolling out into real world. I think making sure that there's alignment on the types of pieces you have in your custom solution. There's a lot of information in the project itself, both in the published spec and going through all of the notes and reading the minutes to see how we arrived at those decisions. And this is one of my slides was talking about how every vendor has been building the solution based on their customers' needs. And this kind of lets us see what more customers' needs are. So you say, I don't have any vendors that have these very complicated structures of FHIR endpoints yet. You will run into them. And so that kind of information, being able to build it in when we talk about, just converting whatever your custom data is into a FHIR bundle that has the appropriate extension fields and everything else, that's a relatively straightforward process that can be done pretty trivially at any point. So I'm not as concerned about that as I am as saying, hey, we want to make sure you have logos, you want to have the usage agreements, these types of things that don't come up unless they're in your context. So working towards that and then giving feedback through the rest of this process to see if there are things that we all missed. I hope that answers the question.
Yeah, unfortunately, as for Lantern, we didn't have much of a perspective on that aspect of it. I mean, I do, recognize like the issue and kind of pain point. But yeah, Gina, I think your answer is like really good, getting at like, the aspects of how to make it easier. But yeah, I mean, obviously we presented a lot about how, there are these, certified patient-facing APIs, in the certified EHRs, and can understand like kind of like the pain point where you may have established integrations, and kind of switching over to those new endpoints, might be kind of tougher to do. But obviously the work talked about today is, obviously meant to make that easier because, we obviously believe that, using those standards-based APIs and, the interoperability, achieved from using those across different applications, would be the, long-term best case. But yeah, appreciate, that it's going to be kind of sharing those experiences, and that's useful information to know. I don't see any other fresh questions in the Q&A. And yeah, I mean, obviously, I think we have the discussion questions here on the slide. I mean, I think in general reflection, I'm always interested to know, what Lantern, can do better to support implementation and address barriers that people are facing. How can we constantly make Lantern better? I know for folks here, for Inferno, and I'm sure for Gino, like, hearing from folks about, how things can be improved, or, what pain points we're not looking at, or, I obviously have, a lot of interest in knowing, what those are from folks. Obviously folks can feel welcome to share live today, during the session. We are going to, have contact information for folks as well. I'll even go ahead and put in the Lantern resource mailbox in the chat for anyone specifically interested in emailing our team specifically. But yeah, I mean, obviously folks have questions about Lantern or, on the utility of it, etc. I mean, feel always welcome to email that resource mailbox directly. But yeah. But yeah, go ahead, Gina.
Oh, no, as I say, I see a couple more questions that popped up in there. I don't know if we are on time yet. I think we have a couple minutes. Talking in particular, one that jumped out at me is the barriers to FHIR implementation being the backwards compatibility in FHIR and IGs. It's not a quick discussion, so I will just put a quick pin in it to say that it is a very active discussion in the FHIR community. It's something we've been talking about for at least a year at the work group meetings in very long sessions about how we can address some of these versioning challenges and what tooling can help and what processes can help and all these things. So we do hear that and feel that pain, and we feel it ourselves. A lot of the changes, for instance, in R5 broke the publication tooling because they were incompatible changes. And then we had to rebootstrap our own tooling and things like that. And we know it's there and we try to be aware of it. And definitely if you have comments on that on Zulip, chat.phir.org, you can bring those up there. And if you attend any of the HL7 FHIR workgroup meetings, there's always sessions about that as well.
Yeah, thanks. Yeah. I know it's a Friday afternoon or morning, depending on where you're at, or evening, I guess, too, for European friends. But yeah, I mean, I don't want to string it out for any longer than we need to. Certainly want to open up to any of the speakers if they have any closing thoughts or anything they wanted to share based off any of the questions that came up. But beyond that, I think we can sort of close things out. So just one last chance for speakers to share any closing thoughts. Great. All right. Well, again, appreciate the attendance, sticking with us to the very end, going through some questions and answers. Again, the slides and recording will actually be made available publicly after the session. So look forward to that and follow up based off your registration. And obviously, yeah, for Lantern, hit us up at lanternproject.hhs.gov. For Inferno, there's a Help IT feedback and inquiry portal. So in particular, inquiries about Inferno can be addressed through that portal. So feel free to check that out as well. And then, as Gina had suggested, go to chat.phir.org and look up, specific topics and chat people up to get answers. All right. So once again, thank you all. Thank you for all our speakers. Thank you, Gina. Thank you, Scott. Thank you, Keith. Thank you, Wei. Particular thank you, Wei, for all the planning that went into the session today. And thank you to Tom for facilitating. Thank you all. Have a good rest of your Friday.
Thank you. Thanks all. Cheers.